Hi Miranda.
Hi.
My name's Hannah. I'm an occupational therapy assistant student. My understanding you're post-surgery, hip surgery.
Yep.
Can you show me which side that's on?
Yeah, it's on the side.
Okay. Before we get started, I'm going to step away and wash my hands. Are you experiencing any pain today?
Yeah, I'd say I am.
A little bit?
Yeah.
On a scale from 0 to 10, 0 being none, 10 being the most?
Probably like a 3 or so.
A 3 or so? Alrighty. I'm going to ask you again later, see if that pain increases. Just let me know if things get too unbearable.
Okay.
Okay. So, left side, correct? Are you aware of your precautions with this surgery?
Kind of.
Alright, let's go over them because they're really important. So first of all, no bending past 90 at the hips. So when we're in a seated position, you're going to have to lean back a little bit. No rotating this foot. So we want to keep your toes pointed to the sky. Are you aware of your weight bear status?
I believe I'm as tolerated.
Correct. So you are as tolerated. So we want to put most of our weight here, but you can use this foot a little bit. The other thing we want to be conscious of is no crossing your feet.
Okay.
Alrighty. So I'm going to have you start with bed mobility, so you'll lift this leg up. So this is going to help you move around a little bit. Go ahead and sit up on your elbows. I'm going to have you lift up your hips. Perfect. And you can go head back down. In the same fashion, lifting your hips, I'm going to have you scoot down to the edge of your bed, keeping those toes, and then back up. Good. Alrighty, so how'd that feel? Good, pretty good. So I'll have you do a similar thing, but move towards the edge of the bed. Good. So now we're going to work on a little bit of lower body dressing. So we're actually going to put sweatpants on, socks and shoes. Then we're going to use your walker to get up and move around and go sit in the chair over there. So there is 3 ways we can do this, getting out of bed. You can use my gait belt here and kind of use it to support your leg and bring it to the floor. Or you are young and healthy, so if you wanted to do this independently, you do have that option. If you didn't feel comfortable with that, I can give you a little assistance.
I think I'd like some assistance.
Some assistance? Alrighty. So I'm going to support you here and behind your back. Go ahead and get up on your elbows. And then be conscious of your toes pointed to the sky. And then no bending past 90 at your hip. So go ahead and swing around. Perfect. Alright. In order to be safe, I do have to put a gait belt on you. So this should be a little snug, but not uncomfortable. Does that feel okay? Too tight, too loose?
That's good.
Tuck this, get it out of our way. Alright. A little redundant, but can you remind me of your precautions?
No bending at the hip. My feet can't cross. Toes point up.
Perfect. Alright. So I'm going to put this down so it's out of your way. And we're going to use some equipment today. This is a reacher. Have you ever used one of these before?
No.
Okay, so we have the trigger here, opens and closes this. You don't want to pick up anything too heavy with this because it will break it. It's not too sturdy. If you need to push or pull anything, this hook is good for that. So you'll find that out when we put pants and socks on. It does have a metal end, so if you dropped anything metal, or a magnetic end, so if you drop anything metal, you can pick it up. So I'll give you that. And then we're going to just start with the sweatpants. I'm going to have you reach with your reacher. Perfect. Go ahead and unfold those. And then we're going to start with your left leg because it is the affected one. We have all the rules with it. So have you scrunch up that leg of the sweatpant. Good. And then I'll have you insert your reacher to hold that open. And then lower it to your foot. And this is going to be really hard not to wiggle your toes, but you need to try really hard to keep them pointed up to the sky and lean back a little bit. Perfect. And then this leg, you can put it in however you'd like as long as you're not breaking those precautions. Alright, great job. Now you have you use your reacher. You got some socks and shoes down there, so go ahead and pick up your socks. Good. And then just because I want you to practice using that reacher, go ahead and reach for that equipment. Do you know what that is?
No.
Alright, this is called a sock aid. It's going to help you put on your socks independently without breaking precautions. So it has these handles that'll help you lower to the floor and bring it back up. So go ahead and grab one of your socks and you're going to slip it over the top with the heel on the back side. And then you want to stretch that as far as you can down. Okay. This part, you're going to want to wiggle your toes, but keep them pointed to the sky. So go ahead and lower that down. And you can bend your knee if you need to. Just keep those toes pointed. And you're going to insert your foot all the way down to the toes and begin to pull towards you. And then once you get to the heel, you're going to want to lift up so you can bring that heel over. Alright, how did that go for the first time?
It's not on all the way.
Alright. Would you like some help or would you like to use your reacher to try to do it yourself?
I'm gonna try to use the reacher.
Perfect. It's a great time to utilize that hook. Good job. So this one, you don't have the precaution, so if you can put your sock on, but you can use the sock aid if you need to. Alright, we're going to move on to shoes, so have you reach down and grab the shoes and put them in a comfortable position so you can put them on with all our precautions.
I can't see the other shoe. Oh, there it is.
You got it, there you go.
Okay.
Alright, do you know what this equipment is?
No.
This is a shoehorn, so it's meant to put in the heel of your shoe so it can slip in. So you hold it up here by the red handle and move the shoe to where you can put it in, your foot in without breaking precautions. Remember, you can bend your knee, but to watch your hips and then your toes. Good. That looks perfect. So if you want to use it to put on your other one, or you might not need it, but great job. Alrighty. Have you used your walker before?
A little bit.
Okay, I'm gonna bring this over. How's your pain now that we've been moving around a little bit?
It's starting to get a little worse.
A little bit. Can you rate it for me on that scale we talked about?
Probably just around the 4, not too bad.
Okay. So we're gonna go over some safety things with your walker. These are your locks. So when they're pushed down, you are locked and you are stuck in one place. Every time we're stationary, we do want to have our brakes locked. Anytime you're gonna sit down or stand up. So go ahead and lock those brakes for me just so I can see. Perfect. Alright, remember that your weight bear status is as tolerated, so if it's too much, take some weight off of that affected foot. So we're going to do a lot of the weight bearing with this leg. I'll have you reach forward with this hand, and then we do have to be careful at the waist. So I'm going to help you, and you're going to push with this hand. Alright, on 3. 1, 2, 3. Perfect. Now you can go ahead and unlock your brakes. Yeah, and go ahead and pull your pants up. Good. Alrighty. And remember, wherever your belly button is, your toe should be pointed the same way to make sure we're not rotating. So go over to this chair. And then turn. Make sure we're not rotating that foot. And you're gonna back up till your wheels hit the chair. Go ahead and lock your brakes. Alrighty. Now we have to be careful of the hips. This is where it might be an issue. So if you want to reach back with one of your hands to the chair, and you're gonna lean, and I'm gonna help you lower. whenever you're ready. Good. Good job. Alrighty. How did all that feel?
It felt pretty good, just that little bit of pain increase.
Okay.
But,
So that is something we can talk about. Have you ever used a hot pack or a cold pack?
not recently, no.
Okay, so hot packs would be good before treatment. You use those about 15 minutes or as long as you can tolerate it. So throughout, you'll put some layers on and you want to check to make sure it's not too hot. You should know what you can tolerate, but make sure there's no blistering of the skin. And you'll do that, and that'll reduce some of the stiffness. And then after treatment, if you wanted to utilize a cold pack, it'd be about the same thing, but that'll help with some of that inflammation. Any questions about the hot or cold pack?
Not that I can think of, no.
Alrighty, so you feel comfortable with everything we did in the treatment today?
Yeah, everything felt good. That hip gets a little sore, a little pain.
Right. Probably feels good to get a little independent with some of your dressing.
Yeah.
Good. Alrighty. Can I get your pain one more time?
It's all about that 4.
A 4?
Yeah.
Perfect. Alright, in the next coming days, we'll work a little more, getting a little better with the equipment. And then I'll talk to your care team and we'll talk about doing some hot or cold pack before and after treatment.
Okay.
So I'll see you next time. Thank you.
All right.